Welcome to Alberta Rheumatology, where today we're talking about how to become a rheumatologist. So before you get to rheumatology residency training, there's a number of steps you need to do. First, you need to get into medical school, which is its own process. But assuming you get in, medical school typically is 3 or 4 years, depending on your school. And then you have to get into a residency program. And it's not rheumatology right away. If we're talking about adult rheumatologists, which is really the focus here, it would be a residency in internal medicine. If you want to be a pediatric rheumatologist, you would first do training in pediatrics. This training program is typically 3 years. It can be 4, but typically 3 years before you go on into rheumatology training. And then rheumatology training is typically a 2-year process, so it's about 5 years in total for residency training after medical school. And then for some, they'll go and do extra training after that initial core training in rheumatology. They may want to be a specialist in a particular rheumatic disease. They may want further training in how to do research or medical education or point of care ultrasound or lots of other opportunities potentially as well. In terms of those 2 years though, what does rheumatology training look like? So the key component really is working with rheumatologists who are certified, seeing patients with them, getting feedback from them in terms of how you see and learn how to assess by taking histories, physical exams, and putting that information together to assess patients. This is done in inpatient setting, in hospital, where you may be seeing patients with rheumatic disease who are more acute, who are sicker, who may have more complex conditions, may be seeing patients with brand new or very serious lupus, vasculitis. Sometimes we'll see gout flares, patients admitted for other various conditions. It's not uncommon that rheumatology service in hospital is asked to see patients to do a joint aspiration, so to take fluid out of a joint or inject medication into a joint. And as part of that experience, most rheumatology residents will be part of an on-call team where they may get called after hours to see patients as well. More time is probably spent in the outpatient setting in rheumatology residency, seeing patients in clinic for things like new as well as established chronic inflammatory arthritis like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, so forth. Things like connective tissue disease, so lupus, vasculitis, myositis, and so forth. These patients more often than not are chronic. They may be otherwise healthy, but they may also have active disease. They may be very straightforward with just having their rheumatic condition, but they may also be very complex as well. And rheumatology residency trains you to be able to see patients in any of those situations. Besides seeing patients directly, there's a host of other complementary skills that a rheumatology resident learns in their training. So they will get updated and review and knowledgeable on musculoskeletal anatomy. They'll learn further about musculoskeletal radiology and imaging. They learn about immunology because a lot of the diseases in rheumatology are autoimmune in nature. They learn the underlying pathophysiology for disease, so trying to understand why these conditions happen. And very important to learn the therapeutics, how to treat all these conditions, both through non-pharmacologic measures, meaning things that don't require medications, physiotherapy, occupational therapy, so forth, as well as all the key medications that are used and can be quite complex in treating those who have rheumatic disease. So anti-inflammatories like NSAIDs, disease-modifying anti-rheumatic drugs, and newer advanced biologics and targeted agents, as well as, again, opportunities for joint injections. Rheumatology residents also have an opportunity to spend time in fields outside of rheumatology to make sure they understand how complementary fields work and work together with our field. So things like orthopedics, physiatry, neurology, as well as most rheumatology residents will, in the adult side, will spend time in pediatric rheumatology to understand child rheumatic disease. Pediatric rheumatology residents often will come and spend time with adult rheumatology as well for similar reasons. There's also scholarly opportunities. Most rheumatology residents will attend rounds, so learning opportunities that are done within rheumatology groups. They are often given opportunities to attend national and international meetings to learn or present information that maybe they've researched. So there are research opportunities for most rheumatology residents to participate in. Residents get an opportunity to hone their presentation skills, working on communication and so forth. Rheumatology residents are often teachers at this level, teaching more junior residents, medical students about rheumatology, and to learn how to do that better. And in that same way, continue to develop leadership skills as well. Rheumatology residency is over in most places upon successful completion of all the rotations over the 2 years, and the program signs off that you've successfully completed. And in most places, there will be a standardized exam that you have to write to demonstrate that you have the knowledge and skills as well coming out of that program. The bottom line is a career in rheumatology is a very rewarding experience. Rheumatology residency will provide you the skills to be a safe and competent rheumatologist. And we hope it's a career that you explore because it can be very satisfying as a career choice over your lifetime. For more information on all things rheumatology, check out our website at Alberta Rheumatology.